All right. Well, good morning still. I almost said good afternoon, Facebook. My name is Tyler Mitchell, and I am joined by my friend and colleague, April Porter here, one of our nurses at the Project of the Quad Cities. And today we're going to be having a Q&A over PrEP, which, as some of you may know, is a medication that you can take to prevent HIV transmission. So thanks again to everybody who might be listening today. Of course, you will have the opportunity, if you would like to ask questions, you can feel free to just post those in the comment section below. And myself or April will do our best to get those answered. So we'll go ahead and get into the meat of what we are talking about today. Gonna do some quick switches here. Okay, so April, tell us a little bit about yourself. There's your beautiful picture and some information.
Best picture ever. So I've been a nurse for about 8 years. I've been with the project since last October. It's a great organization, love working there. We provide STI screening, PrEP services for patients, and then there's also our case managers who help patients living with HIV.
For sure, yeah, and we're going to get into some of the specifics real quick before we move into PrEP about our services besides PrEP, so that folks can be aware of what we offer. And then there's me, the loud person who is helping to moderate today. So my name is Tyler Mitchell. He, him, his pronouns. I'm the marketing development coordinator, and I've been with the organization since July of 2019. I'm a proud member of the LGBTQ community. Love a good frozen pizza, so wanted to mention that. Always keep them stored in my freezer, ready to go. And I also have a personal connection to the conversation today because I'm very happy and willing to share that I take PrEP. And we can reflect on sort of my personal experience a little bit as we answer some of our questions this morning. So before we get into PrEP, I just want to talk quickly about the project because there are lots of folks in the community that are unaware of who we are or the services that we offered. We opened in 1986 in response to the HIV and AIDS epidemic. So we are a 501c3 nonprofit and community-based organization. So what that means is we, for many, if not all of our services, do not charge our clients. That includes the STI and HIV screenings that are all offered at no cost. Back in 1986 and still today, bedrock services were HIV medical case management and STI and HIV testing. So what that looks like is, as you mentioned, April, we're providing services to people who are living with HIV and helping to make sure that they have fulfilling lives. Who we serve, right? So we serve a lot of people. LGBTQ youth, 13 to 24, men who have sex with men. That's a very technical term there. People who inject drugs, people who trade for sex, foreign-born, so anybody who might be an immigrant or refugee, transgender individuals, HIV positive and or HCV, so that's hepatitis C positive individuals, people living with HIV and AIDS. Those are our current patients, people living with hepatitis C, PrEP and PEP eligible persons, and we'll kind of briefly mention PEP later this morning. Victims of sexual assault and violence. We actually receive what's called VOCA funding in order to provide services to those people. We'll talk about that momentarily. And then anyone in the community who needs an STI or STD testing and treatment. So this is who we are, right? And I thought I picked this photo instead of really using any, text in order to say who we are. We are a group of folks who are just very passionate about public health and about providing services to, members of communities that are often ignored by, traditional healthcare. These are people who may have had very negative experiences with healthcare in the past, and we want to change that for them and enhance their lives. Our mission is transforming lives for remarkable care, and it connects to obviously everything that we do. Our vision is we dream about creating a world of change by changing one person's world at a time. And then our values: leadership is service, compassion is action, integrity is doing what is right. So really quick, just talking about those preventative health services, right? So we're talking about STI testing and treatment. As you can see on your screen there, we test for all of those different I guess, infections or diseases. Some of those we are able to offer same day results and treatment for. And right now, as a result of COVID, we are offering contactless at home testing. So if that's something that anyone might be interested in, they can certainly find more information about that on our website, including how they can get scheduled for that at home testing. Hepatitis C testing as well. That's a service that we offer, and it's very much needed within our community. And that kind of goes into any sort of financial assistance that those individuals need, case management assistance, and outreach services for those who might have been lost to care after receiving a diagnosis. Then we have PrEP, right, which we'll talk about more momentarily. So that's taking one pill a day adherently. That's a big deal, so that you can prevent HIV transmission. And then you also have this thing called PEP, which is sort of taken after a potential HIV exposure, in order to stop transmission. And it's very important that a person who thinks they might have been exposed take that medication within 72 hours after that suspected exposure. We also offer free counseling services, and here are lovely pictures of our two mental health clinicians. And we have a focus on LGBTQ individuals, anybody who is living with HIV or hepatitis C, and then anybody who might be a victim of crime. Those we can offer free counseling to those individuals, whether that's in a group or family setting. And we also offer some support groups, typically, in person when COVID-19 is not a thing. And then we have those supportive services that we mentioned, right? So what we've done since the 1980s is really HIV case management. So that's what goes into support for people living with HIV. We cover dental, health, and vision premiums, pharmacy and copays, outpatient costs, long-term housing, utility assistance, mental health, transportation. I mean, the list goes on and on. We just basically really act as sort of a middle person there in order to provide funding to these folks, because it's important that they're adherent to their medication, so that they can get what you call a suppressed viral load, so that the amount of HIV in their body goes down. That's very, very important, but it's also important to provide them with services so that they can live a good life, and take their medication adherently. Support services, so services for people who are living with hepatitis C or on PrEP, that can include navigation assistance, benefit enrollment assistance, pharmacy copay, medical labs, copay assistance, counseling, nutritional support, transportation, emergency assistance. I mean, we're basically there for those folks whenever they need us. And then victim services. So again, talked about this before. If anybody has been a victim of a crime in any way, we do receive funding. We can provide PEP access, counseling, housing assistance, medical and pharmacy cost assistance, and any sort of emergency assistance. So that was a lot there, but we got through it. So now we're going to have our conversation here about PrEP, which is really what April and I are excited about. We did get one question here. So Madeline asked, what does taking a medication adherently mean? So is that something, April, would you want to answer that by chance?
Sure. With PrEP, it's just very important to take it every day. It does take time initially when you start it to build up in your system in order to provide the protection against HIV. And so taking it every day is very important in order to keep those levels high enough in your system. As well as, if you take them at the same time every day, it helps it to become a habit and make things a little bit easier in order as, remembering to take it when you need to.
Yeah, exactly. And I think too, within the context of, people who are living with HIV, because, that's when I use the term there. It's important for people to take their medication so that they have that suppressed viral load. We have this concept of U equals U, right? So undetectable equals untransmittable. So a person who is actively taking their medication and has that undetectable viral load cannot pass HIV on to another person through sex. That's been proven by science, and we can provide some additional information there about that. And let me go ahead. We're gonna pop up my face as well. That way we have our slides in the middle here. So yeah, let's talk about PrEP now. So what is PrEP? So basically, like we mentioned before, it's a medication that is taken daily to prevent HIV transmission. PrEP can stop HIV from taking hold and spreading throughout your body. And when taken daily, PrEP is highly effective for preventing HIV from sex, about 99% actually, according to the CDC, and also with injection drug use, about 74%, according to the CDC. How does PrEP work? So, April, I don't know, is this something that you could help to understand for us? I put this nice little graphic on screen to kind of visualize that a bit.
Yeah, I can't really see it very well though. It's very tiny on my end.
That's all right. I'll read through this real quick. So basically, our it really PrEP helps to safeguard the immune system. So what really happens when you experience an infection of some sort, and germs get into the immune system, the T cells are what normally destroy germs or viruses that enter the body. So in the case of an HIV infection, what happens is the HIV virus attacks and enters the T cells, and it uses the T cells to rapidly make copies of itself. And that's how HIV can spread throughout the body. Eventually, because of the infection of HIV, those T cells will actually burst. And the cool thing about PrEP is if it's taken daily, it creates a protective shield around those T cells. That way, or T cells, excuse me, that way they don't burst, and it prevents the HIV virus from replicating throughout the body. So I think PrEP is actually a combination of different antiviral drugs that help to prevent HIV infection.
Mhm.
So who should take PrEP? So the CDC recommends, if you are in an ongoing sexual relationship with a partner who is living with HIV, you should consider PrEP. You're not in a mutually monogamous relationship with a partner who has been recently tested. You're a man who has had unprotected anal sex with another man, or you have been diagnosed with an STI in the past 6 months. You've injected drugs in the last 6 months or plan to in the future, especially with shared needles or works. And then lastly, regardless of gender or sex, you do not regularly use a condom with partners whose status is unknown, and your partner has risk factors for potential HIV exposure. So, April, when you're having a conversation with someone who is coming in and potentially wants to take PrEP, I assume you talk about those risk factors, correct?
Yes, exactly. We talk about the risk factors, um, because that is a, huge part of whether or not it would be right for the person to take. Um, and you had mentioned too when you were talking about how HIV replicates and kind of takes over in the body. Another interesting thing that I think a lot of people don't know, and it's also why it said it's good for somebody who maybe has had an STI in the past 6 months, is that if you have an STI such as chlamydia, gonorrhea, trick, anything like that, because that bacteria is there and your body is trying to fight it, it's a perfect opportunity for the HIV virus to kind of latch on to those cells and take over. So that's why it's important to get tested regularly for all STIs, because that can raise your risk as well.
Perfect. That was good information. Thank you, April.
Mhm.
We'll go back to our April, are you able to hear me?
Now I can.
Okay. So can we talk about the differences between Truvada and Descovy? Those are the two versions or the two medications that we prescribe at the project. Is that correct?
Correct.
And are any
So
huge differences between them?
they're both very similar. Descovy is the newer medication, and it does have a slightly less risk for certain side effects, such as kidney dysfunction, liver issues, bone density problems. The Descovy is, excuse me, less risk for that. It also seems to be less risk for the common side effects that some people might get within the first 2 weeks or so of starting either of these medications, such as like slight headache, abdominal issues, nausea, diarrhea, that kind of thing. Those side effects seem to be less with the Descovy as well. Now, PrEP is important for both males and females. At this time, the Descovy can only be prescribed for males only because there hasn't really been a whole lot of studying done on the protection that is given to women when they take it. So if a female wants to get on PrEP, then Truvada would be their only option. Men could be on both, but we pretty much Descovy is our go-to because of the fact that it has less risk of side effects.
For sure. And I'll just say really quick that I was taking Truvada originally and then just switched to Descovy probably about 6 months ago. I was having always some, minimal side effects with it. And so the nice thing about switching to Descovy was, like the nausea, for example, was not as much of a factor. And the cool thing is too, is that it actually is a smaller pill, which, is always nice too. It's just easier to manage. And I like the fact that even though I don't personally have a history of kidney disease, for example, or any bone issues, it's just less likely to impact those. But then again, Truvada is still completely safe for folks to take, and if it's the best option that is available, and you're at risk for an HIV exposure, then it's certainly something that people should consider taking.
Right.
All right. So, and we also have on screen here kind of a side-by-side comparison of what the different side effects associated with Truvada and Descovy are. So if anybody wants to kind of take a glance at those, and again, that's a resource that we can share afterwards. And April, you kind of touched on this already, but do you have to take PrEP every day?
You do. It's very important to take it every day in order to keep the level high in the system in order to provide protection. I have had a few patients ask me about things that they've seen online or heard from friends about doing different regimens. I can't remember exactly what they are. Something where it's like taking it 2 days before having sex and then 2 days after sex, something like that. But that is not currently approved in the USA. The FDA does not approve that. Whether it's been for studies or whatever. I guess some places in Europe they do that, but as of now in the United States, that is not what we recommend.
Got it. And I know that that is something, April, that, as you mentioned, we have been asked about before, whether or not it could just be taken, right before and like right after, sexual activity. And I think it is something that is being studied, but, we just fall back to what has been proven at this point. And that is that, people need to take PrEP daily when prescribed for that maximum effectiveness.
Correct.
So really quick, want to mention the project's PrEP program, right? Because this is kind of the distinguishing factor. If someone is interested in taking PrEP and they're asking themselves, well, why would I pick the project over another provider? We really provide the full continuum of services here. So everything that a PrEP client will experience, the labs, the nurse visit, and pharmacy costs are all offered at no cost to the client. So we're not asking the client to pay any money to receive these services. What matters to us most is that clients get on PrEP and are, as we've discussed, adherent and taking it because our goal is to prevent HIV transmission and to lower the number of new HIV infections that we're experiencing on an annual basis. We also offer virtual and in-person visits. So this is something that we just recently started doing. And the great thing is if you, whether you're virtual or in person, you get to meet with April, and she is wonderful and amazing and really easy to work with. Meds can be mailed. So if, even though we have that pharmacy on site, if you want your medication mailed to you instead from a convenience factor, we can certainly take care of that. And then we offer flexible lab accommodations. So that could include our lab, which is again connected to our clinic. So if you want to come in to get your lab work done, we can do it there. We also can set up labs at a location near you that you might prefer. We'll still take care of those costs, of course. And then lastly, we also offer curbside lab services where our outreach team will actually come to you at a location of your choosing to draw those labs if transportation is ever an issue. I just want to mention it again, clients receive services at no cost because that is such a big deal. So there is no financial burden in starting PrEP. And teleprep, something that we just recently started, and it's great. Again, this is what April's really running here, but you basically, step one, if you want to start PrEP with us and want to complete a teleprep visit from home, you can schedule your virtual consult at tpqc.org. You simply log on for your consult. You'll talk with April for a bit, maybe a half hour at the most. She'll ask you some questions. Step three is getting those labs completed, and as I mentioned, you can do that at the project, a lab of your choice, or curbside labs. And then finally, once we get your lab results back and everything looks good, we'll get that PrEP sent to you, and it can be by mail, or you can just pick it up at our pharmacy, whichever you prefer. April, do you need insurance to start PrEP?
Absolutely not. Not with the project.
Nope, not with the project. And I mean, we've had folks say to us before that, maybe they have insurance, but they might be afraid of, their parents finding out because they're still on their parents' insurance. And so we do not require insurance. If you have it and you want to offer it, that's great, but it is not required. We do not want insurance to be a factor in stopping someone from starting PrEP that wants to start it. So no cost to folks to start PrEP, even if they don't have insurance. And lastly, how do you get started? Well, the first step is scheduling that free initial consult. You can do that at tpqc.org. You can click on that red schedule appointment button. You'll just select PrEP, and then there are two different options. Again, you can complete your first consult in person at our Moline clinic, or you can select the teleprep option, which allows you to complete that virtually. And that's pretty much it. So I think we're good. April, thank you for your time today. We answered some good questions, kind of walked through the basics here, and had a good conversation. And hopefully lots of people will start PrEP. So go to our website. You can also go to tpqc.org/prep to get more information there. And always feel free to give us a call, 309-762-5433. Send us a Facebook message, or you can, send us, basically, reach out to us in any way that's comfortable for you, and we'll be happy to answer your questions. So April, thank you for your time today. Thanks to everyone who tuned in, and let's get people on PrEP. See you later.
Bye, guys.